My name is Iyabosola Solanke, and this is nursing 430 assessment of nursing assessment for RNs. So today I'll be carrying out a focused assessment, a respiratory focus assessment on my patient, and this is to enable me know if there are underlying issues with her, or to let her know our respiratory system is working fine and that she's okay. So I'll go in now and meet with my patient and we'll take it from there. Good morning, my name is Iyabosola Solanke and I'm going to be your nurse today. Could you please tell me your name and your date of birth?
Yeah, good morning. My name is Iyabosola and my date of birth is 07/12/73.
And what brings you here today?
I have headache and a little bit of pain in my left ear.
Okay. So part of what we do is carry out assessments on every patient that come in. And today, apart from attending to the headache and the air problem, we're going to look into that. Then I'm going to carry out a focused respiratory assessment on you too. Do you have any allergies?
No, I don't.
I'm going to wash my hands and we'll start the assessment. Do I have your permission to carry out an assessment on you?
Yes, you can go ahead.
So my patient has given me the go-ahead to carry out the assessment on her, but I'm still going to check to know the neurological status of my patient because I want to be sure I don't need a family member to help in the process of assessment in answering questions, or if I can rely on the judgment of my patient. Can you tell me the month and year we're in?
Yeah, we're in October 2022.
And where are we right now?
We are in the doctor's office.
Another question I want to ask you is, can you tell me the President of United States as of today? So my patient is alert and oriented ×3. We'll go ahead with the assessment. This respiratory assessment, I'll need certain tools to carry it out. My wristwatch, and that's because it's going to help me in counting the respiratory rate per minute. My hands, I'm going to need my hands for palpation and percussion because I'm going to be feeling the chest and feeling the underlying tissues and trying to know what's going on, if there are if there are effusions in my patient's thoracic cavity, and then I'm going to listen to the sounds of my patient's breath and the lung sound, and that's going to further tell me if there are underlying conditions going on in our respiratory system. So with inspection, I'm looking at my patient. She's breathing on room air. Her breathing is not labored. She's not breathing with accessory muscles. And her colors is bright. Her nails and her nail beds are pink. She has a capillary refill of less than 2 seconds. So that's an indication that she's well perfused and she has oxygen. Her blood is carrying oxygen into every part of her body. Her breathing, her deep, not shallow. She's breathing at a rate of 18 respirations per minute. So I'm going to go ahead and palpate. In the process of palpation, I can feel the underlying tissues, and if there are crepitus or if there are tenderness. Those are indications of a disease process going on. And another thing is she's sitting upright and she's not breathing in a tripod position, which would have been the case if she had emphysema or COPD. And our AP to lateral diameter ratio is 1 to 2, because the length from her shoulder compared to the length from her posterior and anterior compared to the length of her shoulders is in ratio 1 to 2. In COPD and emphysema, this will come to 1 to 1, and that's when they have barrel chest, and that's one of the telltale signs of COPD or emphysema. But I'll go ahead and palpate. And I'll listen for resonance too. So could you say 99 each time I move my hands?
Okay. 99, 99, 99.
I'll do the same in front.
99.
So resonance, it's not sounding dull, and it's not hyperresonant. That means it's because the chest, the thoracic cavity is hollow. There's supposed to be a sort of resonance to it, and it indicates that there's no air, there's no liquid trapped in a thoracic cavity. Another assessment method is percussion. So with percussion, I'm right-handed, so I'm going to put my left hand on her back and hit my left hand with my right hand and see what sounds come out. So this is still showing that my patient is in good health, and there are no trapped air or trapped liquid in our thoracic cavity. Chest excursion is when we put our thumbs together and place at the back of our patients and ask them to take deep breath, and we watch for equal bilateral expansion. Equal bilateral expansion is an indication that both lungs are working properly and there are no deflations. Could you please turn a little bit to the... Okay, thank you. Could you take a deep breath for me? So with each breath, there are equal bilateral expansions. So my patient's lungs are equal and they're moving bilaterally at the same time. So right now, I'm going to go ahead and listen to her lungs. I want to listen for adventitious sounds. I want to listen to know if the breath sounds are clear, coarse, or diminished. And I'm going to place the diaphragm on a thorax. So placing this on a trachea, I got clear sound. Can you take a deep breath for me, please? I listened to all the lobes of her lungs. I listened over her trachea and I got clear sounds. It wasn't diminished. I listened on the lateral lobes, they're all clear. And at this point, I'm going to document and hand over care of my patient. Thank you. I'll go and wash my hands. Thank you.